Thank you. I'd like to begin with just a little bit of a history of framing mental health as a public health problem, emphasize some key points, many of which we've heard from our prior speakers, and then end with some key policy recommendations for promoting children's behavioral health. It was as early as 1954 that the first Director General of the World Health Association emphasized, without mental health, there can be no true physical health. And then over 4 decades later, the US Surgeon General's office issued a landmark report that framed mental health as a public health issue. The Substance Abuse and Mental Health Services Administration, with assistance from the National Institute of Mental Health, produced a supplemental report that focused on racial and cultural issues in mental health, including disparities. Importantly, the World Health Organization Constitution in 2006 framed health as a state of complete physical, mental, and social well-being, and not just the absence of disease. This is a really important point. And then following that landmark Surgeon General's report, there was a call to action regarding children's mental health in particular. To quote, "Mental health is a critical component of children's learning and general health. Fostering social and emotional health in children is part of healthy child development and must therefore be a national priority." Briefly, here's the landscape of children's mental health. Most mental disorders in adults can be traced to an onset in childhood. Estimates are as high as 20% of children in the US have a mental health problem, and only 20% of those receive mental health services. This has been coined the 2020 problem. This situation is worsened by a lack of funding and providers and by gaps in implementation of evidence-based practices. Treatment for some type of mental health disorder accounts for the largest category of spending of health dollars for children. And this does not include additional costs in other sectors, such as education, child welfare, and the justice system. But it's been difficult to obtain significant traction since the Surgeon General's call to action. Perhaps the largest obstacle we've faced is the absence of a clear and unifying definition of child mental health. It's a critical part of healthy development, and it incorporates mental, social, emotional, and behavioral health. The status quo continues to allow knowledge to remain in silos, to contribute to a lack of public understanding of available science, and it has made collaboration difficult. So children's mental health in this broad definition is not confined to a single service sector or area of public policy. It's a broad public health issue and inextricably linked to policies related to health, education, and safety. These programs and policies include areas of child care, education, child welfare, disasters, school safety, juvenile justice, and there are others. Quite simply, child mental health should be addressed where children live, play, work, and grow, wherever children are. So what do we do? In order to promote behavioral health and reduce mental health and health disparities, we need to promote healthy development for all children, including those with specific health conditions and mental disorders. We need to educate the whole community about healthy social and emotional development, not just parents and caregivers. And we need to disseminate and facilitate implementation of evidence-based programs and practices. This new website just launched this week is one illustration of using technology to share evidence-based information. It was just launched by the Consortium for Science-Based Information on Children, Youth, and Families, a collaboration of 7 divisions of the American Psychological Association. The name is infoaboutkids.org. So to promote healthy environments, we need to move upstream with a focus on the social determinants of health and life course health development, and promote healthy environments and early relationships. Prenatal and early life experiences affect adult health. We need to focus in early childhood for promotion, prevention, and early intervention. Research concerning adverse childhood experiences and toxic stress in early childhood are clearly helpful for identifying opportunities for promotion and prevention. And as we've heard earlier, we need to integrate across sectors: health, education, social services, and the justice system. Currently, public policy turns on when there are problems. But instead, policy should look upstream toward mental health promotion and prevention. This will require new financing strategies. And of course, the greatest opportunity for savings is found in early childhood. James Heckman's work, which has already been cited today, is perhaps the most widely used to support public policies for investing in early childhood. Quite simply, the earlier we invest in development, the greater the impact. The President's Council of Economic Advisors have recommended investments in young children, particularly in early education. Now, the Affordable Care Act has built upon the Mental Health Parity and Addiction Equity Act in advancing insurance coverage for mental health and substance abuse services. It has stimulated attention to mental health promotion, prevention, and access to evidence-based care, and it has facilitated a two-generation approach. There still is, however, a state patchwork of coverage. There are multiple opportunities in the Affordable Care Act for a two-generation approach to health. There is an emphasis on a family-oriented approach, including that educational achievement is correlated with improved adult health. It's important to support education and employment opportunities, not just for growing children, but for parents. And there can be a focus in the Affordable Care Act coverage on the health of the most vulnerable children and their parents. That includes expanding Medicaid coverage, fostering improved outcomes for both parents and children through home visiting programs, screening, diagnosis, and treatment for both child and adult mental health, and integrating health with human services in communities. The National Academy of Medicine has convened a forum on promoting children's cognitive, affective, and behavioral health to advance implementation of evidence-based programs and practices. The CDC is among the sponsors of the forum. And now some recommendations. We need linkages and blended funding streams across health and education, primary care and schools, and healthcare and community programs. Linkages across sectors will accommodate the reality that an intervention in one silo affects outcomes in another. This relates to the problem of fractionation that Dr. Thompson introduced and that Dr. Dworkin's model illustrated. Linkages will require innovative financing strategies, including blended funding streams. Number two, behavioral health should be fully integrated into primary care. This will require innovative ways to promote child mental and behavioral health. School-based health centers need to be funded to provide behavioral health services along with federally qualified health centers. Here's a few more examples of the two-generation approach that I was mentioning. It will be important to promote prenatal development and healthy parenting and attend to parental depression in the primary care setting. It'll also be, of course, important to screen for behavioral health during well-child visits. My third recommendation, it's important to educate adult health communities about the life course health perspective, promoting healthy child development for lifelong health. As we've heard, early childhood, positive parenting, and prevention are in the mental health goal of Healthy People 2020. Number four, we need to measure return on investments with children and families, accounting for development and future targets, like health, educational attainment, and work productivity. Timelines for return on investment are often determined by budget and funding cycles rather than expectations regarding outcomes. And finally, number five, policymakers should focus on those children and families who are at risk rather than those who use the most services. A change in policy focus will be necessary to improve population health.